therapy and exposure therapy in the context of OCD most often involves trying to get people to tolerate, not relieve their anxiety. This is extremely important. And I realize there's variation to this depending on the style of cognitive behavioral therapy, the style of exposure therapy, but almost across the board, the goal, again, is to get people to feel the anxiety that normally they are able to at least partially relieve, however briefly, by engaging in the compulsion. So if we think back to that circuit of corticostriatal thalamic, what's going on here? Where is CBT intervening? Well, as you recall, the cortex is involved in conscious perception. The thalamus and that thalamic reticular nucleus are involved in the passage of certain types of experience up to our conscious perception, not others. And the striatum is involved in this go, no-go type behavior. When OCD is really expressing itself in its fullness, people feel an anxiety around a particular thought, and they either have a go, for instance, wash hands, or a no-go, do not turn left type reaction. By having people progressively, in a kind of hierarchical way, reveal their precise source of anxiety, their utmost fear in this context, what happens is they feel enormous amounts of autonomic arousal. Now, in the context of anxiety treatment or other types of treatments, the goal would be to teach people to dampen, to lessen their anxiety through breathing techniques or through visualization techniques or through self-talk or through social support, any of the number of things that are well known to help people self-regulate their own anxiety. Here it's the opposite. What they're trying to get the patient to do is to really feel the anxiety at its maximum, but then do the exact opposite of whatever the normal compulsion is. So if normally the compulsion is to wash one's hands,